to show the school to people in the outside world. We're still a very small OET school, so it's just a way to promote some of the classes. So I'm going to start the recording now. And here we go. Let's get started. Okay, so this is OET Listening. It's part A. We're going to look at techniques, and then we're going to do some practice. The next thing I want to do is just share my screen with you guys so you can see my document. Can everyone see my... Ooh. Can you guys see my document now? Can you see this?
Yeah.
Yes.
Yeah?
Yes.
Okay, fantastic. All right, so as usual, I like to do things in threes. So we'll start off just a format review, just for anyone who is new to OET. Is there anyone here who does not know OET very well? Maybe for your first time doing OET. All right, so you're all seasoned, well experienced. Okay, so we'll do a very quick format review. Then I'll talk about techniques that people usually use. And then, of course, we'll do a practice test. And we will analyze the answers. And I think this is where it's very important and you can learn something. Okay. All right, so let's get started. Rima, I know that you're not new to OET.
Okay.
So this should be easy for you, Rima. How many questions are there in listening part A?
24 questions.
All right, guys, is it 24 or 20?
Oh, 20, sorry, reading.
No, it's 24, you're right.
24.
24.
Sorry, I tricked you, I'm sorry.
I'm confused.
In reading, there's 20.
Yeah.
In listening, there's 24. I'm seeing if you're sure. Okay, so there's 24 questions. How many audio clips are there, Farouk? How many clips?
Yeah, for port A is 2.
2 clips, right? So we'll listen to 2 audio clips. How long are they, approximately?
5 minutes.
5 minutes.
4 to 5 minutes.
Sometimes they can be 4 minutes, sometimes 5, sometimes 6. So let's just say 5 minutes, approximately. So you're going to listen to 2 5-minute clips, okay? It will always be a consultation situation, right? So you'll be a GP talking to a patient, or what else could it be?
Specialty doctor.
Specialist.
Okay. So sometimes it's GP and patient is talking to GP about a new condition. Sometimes it's specialist and the patient has been referred to the specialist and the patient is telling them the story. Okay. So 24 questions, 2 audio clips. Each clip is 5 minutes long. How much time before audio starts?
30 seconds.
Yeah, thank you. 30 seconds. Okay. Now that's an important one, so we'll come back to that. The style of question, the question style is what? What is this?
Gut feel. Gut feel.
Feeling.
Fill in the blanks.
Gut feel.
In the blanks. Okay. So we're just filling in the blanks. They're usually case notes. In fact, they're always case notes. So fill in the blanks with case notes. What kind of listening? What kind or type of listening?
Details.
Yeah,
Obtaining detail.
details. It's not understanding. It's just getting those specific details. Is spelling important? Can I make a spelling error?
No.
In IELTS?
Yes, then reading is, yeah.
You can, yeah. Yes, but only small. Okay, so you can make some spelling errors, but only small. How much time do I have at the end of the listening test?
2 minutes. 2 minutes.
2 minutes for read, nice. So 2 minutes at end of test for what?
Check.
To check
For check.
Okay.
answers, yeah.
So you should check part A. Why should we check part A and not B and not C?
Some spelling or some words which we
For spelling, yeah.
some long words that we can know, then you can
Yeah.
correct it.
Yeah, we can't check B, can we? We can't check C. We're not going to remember That's just multiple choice questions, so we will not remember what was said, but we can check part A for spelling. And also a piece of advice, tip. If the word is very long, what should you do if the word is very long?
You can just have a little
Note.
Write abbreviation.
Yeah, write notes. Write notes if the word is very long. For example, immunosuppressants. How do we spell this?
Immunosuppressant.
Yeah.
Yeah,
This,
sorry.
you.
Noise, guys. Sometimes people just call me randomly on Skype. Immunosuppressants. Okay. This is such a crazy word. Look at this.
Mm.
Will you have time to write that down in the exam?
No.
No, right? Because the next question will come
Mm.
before you finish. So what you should do is write down notes, right? And then later at the end, check. So, for example, what would you write for immunosuppressants? What's a good note form for that?
Immunosuppressant.
Like immuno?
SUNT.
Yeah, you can use your own language even if you want.
Yeah, sometimes I use
Yeah.
my language.
Choose your own language, but so long as you can remember when you in those 2 minutes, okay? All right, so this is the test. Does anyone have any questions? Lisa.
Hi, Alan. I just have a short question for the notes. Are we allowed a piece of paper during the computer-based test to make a note?
People have asked me this a lot. I think the answer is no. No, you're not. So it's not really very nice, is it, if you're doing the computer-based?
No, because that's the problem, where to write the note at.
Maybe they has anyone done the computer-based test? I think it's slightly different. I think there's a slightly different. Let me just, is that Lisa? Are you new to the school?
Yes. No, I'm not new.
Ah, right. Okay. Sorry about this, guys. Don't know why people keep calling me on Skype. Sometimes they don't wait, they just call me. So I just want to show you something, Lisa. Okay, so OET what? Official OET. You've all seen this site, right? You've all seen this website here.
Yeah.
Can everyone see this here?
Yes.
Yeah. So we've got listening sample tests here. And I don't know if you've seen this already, Lisa, but they have computer-based examples here.
Oh, no, I've never seen that.
So on computer, you can just do this one here, I think. Maybe this one. And it will load test. So try it out. There you go. Try it out. All right. So if I do OK now, it will start this test. All right.
Okay, I will just.
We've lost the screen there. But try that because I think that would maybe answer your questions. Okay.
Okay, thank you.
All right. So coming back to this, guys, look, this is the test. 24 questions. There's 12 questions for each clip. 12 per clip. Each clip is 5 minutes. It's always a consultation, GP or specialist. You're filling in the blanks and you're listening for details. You've got 30 seconds before it starts. And you can make some errors with spelling, but only small ones, okay? Don't forget at the end, you've got 2 minutes to check your spellings. Okay, so that's the format of this test. In terms of techniques, let's think about techniques, okay? Can I ask one of you to just tell me what you normally do? For example, maybe Layla. What do you normally do, Layla?
When I'm listening test,
Yeah.
first of all, I'm trying to read as much as possible and trying to guess some answers like condition, medication or something to have any idea. And
Yeah. So you're reading and just trying to get, when you say guess though, what do you mean by guess?
Predict.
predict, yes, I can predict some of them.
So we might say here like medical history, right? For example,
Yes.
might say like that, and then it will say, takes blank for headaches, like that, yeah?
Mm-hmm.
So what is the missing word here, guys?
Mitigate. Category medication.
We don't know what she's taking, but we can say it will be a medication.
Medication, yes.
So the most simple technique is predict the category or type, right, of answer.
Sometimes they are talking about symptoms or, for example, occupation. I'm hunting for a job in this case, if it's talking about occupation, for example.
Yeah. So I might say works as. Now be
As
careful.
a volunteer or as a doctor or as a teacher, something like that.
Be careful with this one because sometimes they say full-time mother, right? I mean, obviously that is a job, but you might not be expecting that. Yes. Okay. So we can predict the type of answer. Is everyone okay with this? I talk about this in my video course. Okay. You're predicting the type of answer, and usually there's probably about 12. There's approximately 12 types of answer, categories of answer. So it's always symptoms,
Medication,
what else?
condition,
Conditions, what else, guys?
test,
Adjective.
Shout out if you know. Tests,
treatment,
Equipment,
Nouns like body parts.
job,
job
body parts, yeah.
description, job description,
Could be a
time,
job.
Operation.
It could be diet as well. Don't forget diet sometimes. What else?
action, time,
Action. Action
Yeah.
is a good one. Like she is unable to blank up the stairs.
Yes.
Okay.
Fine.
and this description of
Now, the one that I've been teaching OET a long time, and I remember when I realized this one.
description of
description,
This one is
Description.
special.
Yeah.
Because you're not listening for a noun. Usually you're going to listen for a noun.
adjective, yeah.
adjective,
But here it can be noun or adjective. Right? It can be both. So for example, it might say, guys, like for example, look at this, you know, it might say she has a blank rash on shoulder. What's that going to be?
Can be
Adjective,
adjective,
The description of, right? It's going to be like painful,
red or
itching, rain,
itchy, right? So description of is a very good prediction. It's a very good, because you see that very often, okay? But yeah, we get sometimes tests, sometimes we get actions, sometimes we get body parts. There's about 12, approximately. You always see the same ones. You always see the same ones. So you can predict things very quickly, all right? Let me give you an example. Everyone, okay? Let's play a game. You have to predict the category, okay? So imagine it says like this, regularly consumes blank for energy. What's that?
noun,
Diet.
chocolate bar.
Diet, isn't it?
Diet.
Diet, yeah.
Diet.
Good. Okay, what if it says she has issues? What's that one?
Equipment.
yeah.
Condition.
I would say that's not equipment, no. Something to bathroom.
Action.
Action, like walking to bathroom, right?
Showering or something,
Yeah. What if it says something like blank were performed?
performed,
Action.
Yes.
yeah.
test,
Because we perform tests, right? What if it says blank was prescribed?
medication,
Medication.
So we can kind of predict the type of answer, and it's not that difficult, okay? If you just practice a little bit. And we'll practice today. Another very simple thing that I often talk about is what's called a signpost, okay? So for example, if you see this, it might say painful arm, right? Painful arm, or painful, I don't know, leg. Why is that there? There's no gap. There's no gap.
signposting
It's a signpost, isn't it?
before the answer.
It tells me the answer is coming. It tells me this answer is coming, okay? But something maybe, if you're new to OET, you didn't think about this. There can be good signposts and bad signposts. So this is an example of a good signpost. Does that make sense, everyone? It's good because it's on a different line to the answer. Does that make sense, everyone? Equals different line. What if I take shoulder? Is shoulder a good signpost? Is it a good signpost for this one?
No,
No,
no.
Is headaches a good signpost for this one?
no,
Why not, Rima? Why is headaches a bad signpost?
because signposting is word before the answer. It's good.
What
Agree.
if it said, okay, what if it said, so this is because it's after the answer. This is
After
after.
the answer, yeah.
What if it said, after running, she has a rash on shoulder? I don't know why.
Yeah, it's a good signpost. It's a good.
What do we think? Is that good? Is running a good signpost?
No. It can
It should
paraphrase.
be for
We can
some.
paraphrase it.
Yeah, it's
I
not.
think it's good. No?
No. I'll tell you why. Okay, so the word running, I always say, is a bad signpost because they can paraphrase. Okay? Just because it is written before the answer does not mean it will be spoken before. Does that make sense?
Yes.
You might say this, "Oh, doctor, I have this pain in my shoulder, and it's a very severe pain, and it happens to me when I play football and also after running." Right?
Severe.
So we cannot rely on that as a signpost. We can only rely on things that are on a different line. Okay, so it has to be on a different line. If it's on a different line, okay, no problem. We can say, okay, 100%. That will come before the answer for that, okay? So very simple idea. There are good signposts and there are bad signposts, all right? And I'll show you an example of this when we practice. One final thing I want to talk about with techniques. What about if it says this? Okay, look at this. What about if it says hobbies? Okay, here it says hobbies, for example. And it says, plays blank. Can anyone predict the gap?
There's a tennis.
Is it, you think I play tennis?
No, any game.
It can be any
Game, any
select
game,
one.
yeah.
game. So we can predict this one as game.
Play card.
This will be sport. Does everyone agree?
So,
Yes.
Okay, but what if it says, what if I say, for example, tell me what's the answer? So doctor, don't worry, I have lots of hobbies. I play tennis and basketball, and I also play cricket and football as well. What's the answer?
tennis,
Tennis, basketball,
basketball,
so many hobbies.
We don't know
We
which
don't
one.
know, do we? We don't know exactly. We don't know.
Yes.
Right? Maybe we can write all of them. We can write every single one, maybe. But usually in OET, what will happen is it'll be like this. So doctor, I play lots of sports. I play tennis and I play basketball. And I also play cricket on Wednesdays. And as well as that, I play rugby.
cricket.
What's the answer, guys?
Cricket.
So how did you get the answer?
On Wednesday.
On Wednesday.
Easy, right? So this is not a signpost, is it? This is not a signpost. What is that word?
Selector was?
It's like a selector, isn't it? Yeah. It helps me to decide if I get two possible answers, right? So we're not saying that running is not important. Running is important, but not as a signpost. It's important as a selector to help me choose. Okay. So these are all the techniques that I've been teaching this a long time. This is the way that I do the test. I always do the tests with the students. Okay. So I'm always predicting the type of answer here. I'm always doing that. I'm always thinking, okay, what is a good signpost? And also, if I have time, I'm also thinking, okay, this is not irrelevant. It's relevant to me because it might help me to choose the correct answer if there are two possible ones. Okay. Now, I appreciate some of you might be thinking, okay, Alan, but how can I remember all of this? Let's do it together. Let's do a test together and I'll show you. Okay. Is everyone ready to take all of this and put it into a real test?
Alan,
Yes.
Farid, if you have a question, sir, go on.
sometimes they like fill in the blanks, the previous pain and shoulder, they say in the start and the other thing in the back, and they take the words like paraphrase the words that we are waiting for 10-15 seconds, and sometimes it go. So that's sometimes already you explained,
Agreed.
but
Yeah, I mean, paraphrasing, guys, don't forget, they will paraphrase a lot. You can't, it's very difficult sometimes because they're not going to say it like that. They can make you, sometimes they'll make you wait a long time between the answers as well. So let's just practice it, guys, and you'll see an example and I'll show you how I prepare. Okay.